Hola! Oh,
Hi
there! I am FLUOXYMESTERONE.
What? But I'm Ultendred.
Girl, we're basically just the same thing. I am just the generic name.
Okay.
We belong to the family of androgens.
So today, we will be talking about FLUOXYMESTERONE. Basically her. And me. But I guess we'll find it out later. So, tune in, sit back, relax, and listen to our video. We hope you learn a lot from this.
So like what I said earlier, my generic name is FLUOXYMESTERONE. I'm manufactured by many pharmaceutical companies, that is why I have a lot of brand names. Android F, Androxy, Halestin, Oratestrel, and Ultendrin. My chemical name? It's too long. You can read it.
Now that you know my drug names, let's learn more about my drug classifications. I am classified into two types. My therapeutic classification is classified as androgen replacement and antineoplastic. Meanwhile, I am classified as an androgen for my pharmacologic classification.
That is a good question. I am considered as pregnancy category X. Studies shown that both in humans and animals, I am a great risk to the fetus and to the mother. The risk clearly will outweigh any potential benefit. That is why always take note. I am a big no-no for pregnant women. I am considered as a synthetic androgenic anabolic steroid. It is also found that I am approximately 5 times as potent as natural methyl testosterone. The anti-tumor activity present similar to the actions of my related to the reduction and other androgenic hormones of prolactin receptors or estrogen receptors. As I bind to an androgen receptor, I produce retention of nitrogen, sodium, potassium.
Let us talk about my pharmacokinetics. I have approximately 80% of oral bioavailability. I am then metabolized in the liver. I have an elimination half-life of approximately 9.2 hours, which is long relative to that of testosterone. Finally, I am eliminated in the urine.
I am indicated for the following medical conditions. In male hypogonadism, I am used as a replacement therapy in conditions associated with symptoms of deficiency or absence of endogenous testosterone. In palliation of breast cancer in women, I am a palliative treatment for recurrent estrogen receptor positive breast cancer. I am also an effective androgenic hormone in the treatment of advanced breast cancer and may be considered the androgen of choice at present.
I am also used to stimulate puberty in men or supply the lack of testosterone in the body, as well as in postpartum breast engorgement. I am used to suppress or control lactation in women.
These are the following contraindications contraindications and cautions when using me as a drug. I am contraindicated in pregnant patients and breastfeeding women, as well as in the presence of prostate or breast cancer in men, since it can be aggravated by the testosterone effects of the drug. I am also contraindicated to those who are allergic to the drug or the ingredients of the drug, to prevent hypersensitivity reactions from the patients.
I am also contraindicated for patients with liver dysfunction and cardiovascular diseases, since these patients can be exacerbated by the effects of hormones. In pubertal teenage boys, I am only administered by specialists, since they are aware of the adverse effects I have on bone maturation. Skeletal maturation must be monitored every 6 months by an X-ray of the hand and the wrist. I have a high risk of virilization. This means developing masculine traits in women and development of priapism in males. And if I am taken in high dosages, oligospermia may occur.
Now we have reached this part. Once you have taken me, it is important to look out for the side effects and contact your physician when it is alarming. In the cardiovascular system, the side effect is edema. In the digestive system, the side effect is nausea.
Polycythemia and suppression of clotting factors are also side effects, as well as reversible jaundice, biliosis, cholestatic hepatitis, and liver cell tumors. There will also be hypersensitivity skin manifestations. Side effects in the central nervous system is headache, anxiety, depression, paresthesia, and sleep apnea syndrome. Excessive hormonal effects in men will result to prepubertal premature epiphyseal closure, epididymitis, gynecomastia, decreased ejaculatory volume, priapism, growth of body and facial hair, postpubertal testicular atrophy, acne, oligospermia, impotence, and phallic enlargement. Meanwhile, the androgenic effects in women are acne, oily skin or hair, decreased breast size, male pattern baldness, hirsutism, deepening of voice, hoarseness of voice, edema, changes in libido, weight gain, and clitoral enlargement. Hypoestrogenic effects in women are menstrual irregularities, flushing, nervousness, vaginal bleeding, diaphoresis, and vaginitis. There can also be potentially fatal effects. The increased risk of hepatic adenoma, hepatocellular carcinoma, and biliosis hepatitis.
Side effects and adverse effects can also be shown in the laboratory results. I may increase liver enzyme, lipid, sodium, potassium phosphate, and calcium levels. I may also increase RBC count, parathrombin, time, and international normalized ratio.
Now, let us discuss the responsibilities of a nurse when handling with me as a drug.
Here are the nursing responsibilities. First, assess for the mentioned cautions and contraindications to prevent any complications. Then, perform a thorough physical assessment to establish data before drug therapy begins to be able to determine its effectiveness as well as to evaluate adverse effects.
Observe women carefully for signs of excessive viralization. If possible, stop drug at first sign of viralization because some adverse effects, such as deepening of voice and clitoral enlargement, aren't reversible. The nurse must confirm the order and use at least 2 unique identifiers other than the room number prior to all procedures, including the administration of medications.
Consider important safety complications to help prevent complications. Then, check the laboratory results, glucose tolerance test, thyroid functions test results, or protein-bound iodine 131 uptake and thyroid binding capacity may decrease.
As a nurse, it is important to implement client education to explain to the patient taking drug for palliation of breast cancer that viralization usually occurs at dosage used. It is important to tell the women to report menstrual irregularities and to stop therapy pending etiologic determination. Advise the men to report overly frequent or persistent penile erections, and advise patient to report persistent GI distress, diarrhea, or onset of jaundice.
In drug administration, you should not forget to document the medication in the patient's chart.
Use cautiously. Observe elderly men for prostatic hyperplasia. If symptomatic prostatic hyperplasia or prostatic cancer develops, discontinue the drug. Prepare for radiographs of the long bones in children to assess for testosterone effects on growth. Evaluate the therapeutic effects of the drug. Make sure the patient receives regular follow-up checkup and the patient and family states understanding of drug therapy.